Hi everyone, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. I've gotten so many requests over the past couple days to talk about the peptide GHK-copper that I'm going to share the evidence-based literature. But before I start, I'm going to kindly ask that you stop the personal attacks. I'm tired of them, and I'm not your bro. Stop telling me I don't know what I'm talking about, because guess what? I know a shit ton more than most of you. And you know why that is? And it's not solely because I'm a surgeon and a doctor, but it's because I'm not ignorant. And if you want to look up ignorant in a dictionary, it does not mean stupid. And none of you are stupid, and that's not what I'm implying. What it does mean is that you are uninformed or lacking knowledge. And you know what the reason for that is? It's because you're being lazy. Let's call it like it is. I do the work to learn, okay? I don't know anything, but you would rather criticize and attack and take the advice of somebody who's wholly unqualified to give advice, and you call them an expert or their go-to. And guess what? Anybody who has an opinion, a following, and is selling something is suddenly an expert, okay? Let's be honest again. Well, guess what? I'm not selling anything, okay? And I have no skin in the game, so stop attacking me. But truth matters and facts matter. And if you want to deal in conspiracy, then keep your comments to yourself and move on. I don't need to hear them. And the people who follow me and want to get fact-based evidence don't want to hear it either. In the last 3 days, I've been approached by 3 peptide distributors to represent them. Sure, they're good people, but you couldn't pay me enough to endorse any of these substances and compromise my integrity. Ozempic or something like that, which is also a peptide. Yes, that's FDA approved in cardiovascular disease and diabetes, and it's fantastic in weight loss. That's different. So now let's talk about today's topic, GHK-copper, which is a naturally occurring copper complex with regenerative, anti-inflammatory, antioxidant properties, which has been studied in skin repair, wound repair, and anti-aging applications. It's present in plasma, saliva, and urine, and levels decline with age. It does promote collagen and glycosaminoglycan synthesis, attracts cellular repair, modulates metalloproteinase activity, supports remodeling and healing in vitro test tubes and in animal studies. It does benefit skin, hair, bones, and organs, and it has anti-inflammatory and neuroprotective effects, allegedly. But human clinical trial data supporting its efficacy are limited. Several reviews and narrative summaries report that controlled studies in humans have shown that GHK-copper can improve skin elasticity, firmness, reduce fine lines, wrinkles, photo damage, and hyperpigmentation, supporting its use in cosmetic products. In other words, it's already in cosmetic products that people use, and that's great. However, these reviews consistently note the absence of robust, well-powered clinical trials and meta-analysis for GHK-copper in humans, especially for wound healing and broader medical applications. However, most published data are from cellular, as I just said, and animal models, and there's a notable absence of large, well-controlled human clinical trials for other indications, such as wound healing, anti-inflammatory effects, or systemic disease. In other words, there are no large, high-quality, randomized controlled trials, which is the gold standard, or meta-analysis published to date that directly evaluate the efficacy and safety of topical GHK-copper in human subjects for skin rejuvenation or wound healing. There are currently no large, well-documented, ongoing, or recently completed clinical trials registered on clinicaltrials.gov or any other database specifically investigating the efficacy and safety of topical GHK-copper in human subjects for skin rejuvenation or wound healing. Now, beyond cosmetic and skin applications, most data are preclinical. GHK-copper has demonstrated protective and regenerative effects in animal models for lung, liver, bone, and GI issues, as well as anti-inflammatory and antioxidant actions. It also has shown potential neuroprotective effects in vitro, again in test tubes and in animal models, but there are no published human trials for cognitive health, physical performance, or systemic anti-aging. Now, I know many of you are going to say, it's pharma, they don't want it done, and that's why these studies are not done. No. All these kind of substances, pharma would make billions, okay? It's because the animal and preclinical studies have either not been great, okay, or have not shown anything that justifies expending an extremely large amount of money to try and bring something into clinical production that most likely will fail. Okay, so with that, hope you learned something today. Thank you so much for listening. For more information, guidance, advocacy, or consultation, you can go to my website at www.paladinmds.com and have a great day. Thanks.